Every year, millions of seniors walk into clinics for routine checkups, believing they are protecting their health and extending their lives. It feels safe, even responsible, to follow the doctor's orders and get tested. But what if I told you that some of these very tests, the ones advertised as life-saving, could quietly push you toward unnecessary surgery, dangerous complications, or even cancer itself? Recent studies reveal a troubling truth. Up to 37% of medical tests performed on older adults result in treatments that were never needed in the first place. Even more alarming, 99% of people over the age of 70 have no idea they are being tested too much, exposed to risks that could diminish their quality of life instead of preserving it. In this video, we are going to uncover 5 of the most common checkups recommended for seniors after 70, and why they may harm more than help. Backed by real science and real stories, we will explore what your doctor rarely tells you, the hidden risks buried beneath the promise of prevention, and the smarter, safer ways to take control of your health. Stay with me because what you hear today could change the way you approach aging forever. One of the first tests many seniors are urged to take is a bone density scan, officially known as a DEXA scan. On the surface, it seems completely harmless. You lie still for a few minutes, there are no needles, no pain, and you walk away with a number that supposedly tells you whether your bones are strong or fragile. Doctors use it to detect osteoporosis, and that sounds reasonable. But after the age of 70, this test often creates more fear than benefit. Bone loss is a natural part of aging, just like wrinkles or gray hair. Almost every older adult will show some degree of reduced density, even if their risk of fracture is not truly dangerous. That's where the trouble begins, because those numbers on the report often trigger prescriptions for medications that carry more risk than reward. Take the story of Rose, a 76-year-old retired piano teacher who lived an active and healthy life. She walked daily, never had a fall, and felt strong. During her annual checkup, she was referred for a DEXA scan, and the result came back showing mild bone loss called osteopenia. Her doctor quickly prescribed alendronate, a bisphosphonate drug meant to harden bones. Within 3 months, Rose developed severe acid reflux and jaw pain, side effects she had never experienced before. She stopped playing piano, something she loved dearly, because even simple practice became unbearable. Eventually, another physician advised her to stop the medication and instead focus on natural strategies: weight-bearing exercises with resistance bands, vitamin D supplementation, and a calcium-rich diet with sardines and leafy greens. A year later, Rose was performing again, her balance and leg strength improved, and she had no fractures at all. Her story highlights what research already shows. Studies following thousands of women over 70 found that bisphosphonate treatment in mild bone loss reduced fracture risk by less than 1% over 5 years. That is far from life-changing, especially when weighed against the risk of esophageal irritation, digestive issues, or even the rare but devastating condition where the jawbone begins to die. By contrast, simple lifestyle changes, strength training, balance practice, and correcting vitamin D deficiency have been proven to reduce fractures by over 20%. That is a real benefit without the burden of harmful side effects. A bone density scan might look like a smart move, but after 70 it can transform a perfectly healthy person into a patient burdened by fear and medication. The truth is, no machine can define your vitality. Don't let a single number on a screen dictate your future when the better prescription may be movement, nourishment, and confidence in your body's resilience. Few things strike fear in the hearts of older adults more than the thought of losing their memory. A forgotten name, misplaced keys, or a moment of confusion can send someone spiraling into worry about Alzheimer's disease. Doctors, responding to this fear, often order a brain MRI, believing that a detailed picture of the brain will provide clarity. The reality, however, is far less reassuring. Most MRIs performed on people over 70 reveal changes that are not signs of disease at all but normal features of aging: slight shrinkage, tiny white matter spots, or harmless irregularities. Once these findings are printed on a medical report, they take on a life of their own, igniting fear and leading to more tests, sometimes even invasive procedures, all without offering true answers. George's story is a perfect example. At 74, he was a retired engineer who enjoyed reading and staying active in his community. He noticed he misplaced his keys more often and occasionally forgot a name. Concerned, His doctor ordered an MRI. The scan revealed nonspecific white matter changes, something nearly all seniors have. But George didn't know that. To him, those words meant impending dementia. He panicked, stopped driving, withdrew from church, and his anxiety deepened. Over the following months, his fear eroded his confidence, even though his actual cognitive abilities remained intact. When a specialist later tested him with a simple paper-based memory exam, his results were normal for his age. With reassurance, lifestyle adjustments like better sleep, hydration, and brain exercises, George regained his peace of mind and stability. His experience is far from unique. Research shows that while up to 86% of seniors who undergo MRIs for mild forgetfulness will show some form of abnormality, only a tiny fraction of those findings, around 3%, are tied to conditions that can be treated. The rest are incidental, yet they trigger unnecessary panic and often more invasive testing such as spinal taps or biopsies, each carrying its own risks. The truth is, a brain MRI rarely helps when the only concern is mild memory lapses. A safer, more effective first step is a cognitive screening test, a straightforward, inexpensive evaluation that measures attention, recall, and problem-solving. It provides clarity without fear, and it can guide further care if genuine issues are present. In the end, no MRI scan can define who you are or predict your worth. Do not allow a shadow on a medical image to steal the peace of your mind. Sometimes, the clearest answers come not from machines but from simple human observation and understanding. Among the most common tests older adults are offered is the cardiac stress test. It sounds logical. Place someone on a treadmill, monitor the heart as it works harder, and see if blocked arteries appear. For seniors, however, this test often creates more harm than clarity. After 70, the accuracy drops dramatically, with false positive results reaching as high as 40%. That means nearly half of the people told they may have a heart problem actually do not. Yet the moment a stress test suggests something unusual, a cascade of further procedures begins: angiograms, catheterizations, stent placements, even bypass surgeries. Each step carries risks far greater than the vague fatigue or mild chest tightness that brought the patient in to begin with. Raymond's experience illustrates the danger. A 75-year-old retired postman, he stayed active by walking daily. During a routine checkup, he mentioned he felt more tired when climbing hills. His doctor, worried it could be his heart, scheduled a stress test. The results were inconclusive, but inconclusive rarely leads to reassurance. Raymond was sent for a catheterization, where a tube was threaded into his arteries to check for blockages. A minor narrowing was found and a stent was placed. That very night, he suffered a severe reaction to the contrast dye used in the procedure, damaging his kidneys. He spent 6 days in the hospital, followed by weeks of follow-up care. His fatigue, it never changed because it was never caused by a heart problem in the first place. He was simply an older man who needed more rest and hydration. Raymond's ordeal is far from rare. Large studies show that more than half of stents placed after stress test referrals provide no survival benefit and no improvement in quality of life. What they do bring are complications: bleeding, kidney injury, and prolonged hospital stays. For seniors without clear symptoms, such as persistent chest pain during activity, significant shortness of breath, or sudden drops in energy, a stress test is more likely to create a patient than save one. Safer alternatives exist. A resting EKG can reveal dangerous rhythm problems without the risks of induced stress. A coronary calcium scan, using low radiation, can show whether plaque is building silently in the arteries. Both are simpler, safer, and more reliable for seniors who are otherwise doing well. The lesson is clear. If you do not have classic signs of heart disease, think twice before stepping onto that treadmill in a hospital gown. Sometimes the best protection for your heart is avoiding a test that could break it. For many people, the word colonoscopy has become synonymous with prevention. Doctors, health campaigns, even well-meaning family members insist it is the gold standard for catching colon cancer early. That message is powerful, and it convinces countless seniors that the procedure is not optional but mandatory. Yet, after the age of 70, and especially beyond 75, the balance of risks and benefits shifts dramatically. What once may have been helpful can become hazardous. The preparation alone can be punishing for older adults. Strong laxatives used to cleanse the bowel can trigger dehydration, dizziness, or even kidney problems. Sedation, often necessary for the procedure, carries risks to brain function and increases the chance of confusion or falls afterward. And the procedure itself is far from harmless. Tears in the intestinal wall, heavy bleeding, and disturbances in heart rhythm are all known complications. A massive study following 1.3 million Medicare patients revealed a sobering truth. For every 1,000 colonoscopies performed in adults over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That is a 10-to-1 ratio of harm to benefit. Dana's story brings this reality into focus. At 73, she was a vibrant grandmother who co-ran a bakery with her daughter. She had no symptoms, no bleeding, and no family history of colon cancer. But during a routine visit, her new doctor encouraged her to schedule a colonoscopy. She agreed, trusting it was the safe and responsible choice. During the procedure, a small polyp was removed, and she went home the same day. That night, however, she collapsed in pain. A bowel perforation had occurred, and she spent 9 days in the hospital recovering. She lost weight, her energy plummeted, and life was never quite the same. The bitter irony is that Dana had already undergone 2 clean colonoscopies in the past. There was no compelling reason to repeat the test. Fortunately, safer options exist. The FIT test, a simple stool-based screening done at home, requires no harsh preparation and no sedation. It can detect hidden blood in the stool, often a reliable early sign of trouble, and it carries virtually none of the risks of an invasive procedure. For most healthy seniors, this test is far more appropriate. The lesson here is clear. Not every polyp needs to be hunted down, and not every scan saves lives. Prevention should never come at the cost of destroying the quality of life it is meant to preserve. The idea of a full-body CT scan is seductive. It is marketed as the ultimate checkup, a way to peer inside every corner of the body and catch disease before it strikes. For many seniors, it feels like buying peace of mind, a single scan that promises safety and certainty. But beneath the glossy advertising lies a sobering reality. A full-body CT delivers an enormous dose of radiation, equivalent to as many as 500 chest X-rays in one sitting. That level of exposure is not harmless. Studies suggest it may be responsible for up to 5% of new cancers caused by medical imaging. What begins as an attempt to prevent illness can, ironically, plant the seeds of it. The greater danger, however, often comes not from the radiation itself but from what the scans inevitably reveal. Human bodies are full of harmless irregularities. Tiny lung nodules, liver spots, kidney cysts that pose no real threat. A CT scan captures them all, and once they are written into a radiology report, they rarely remain harmless. Each one demands follow-up. Repeat scans, biopsies, or even surgeries. What might have been a quiet, healthy life is suddenly consumed by appointments, procedures, and fear. Marcus's experience makes this painfully clear. At 71, he was fit, energetic, and without symptoms. At the urging of a wellness clinic, he agreed to a full-body CT as part of a longevity package. The scan revealed a 3-millimeter nodule in his lung. The radiologist noted it was likely benign, but the word nodule haunted Marcus. His doctor ordered a follow-up biopsy. During the procedure, his lung collapsed, leaving him gasping for air. He spent a week in the hospital with a chest tube, and though he eventually recovered, his life was marked by lingering anxiety. The nodule? Completely harmless, as predicted. The ordeal he endured came not from disease but from a chain reaction set off by an unnecessary scan. This is the hidden cost of chasing certainty through technology. A full-body CT is not a shield of protection. It is a doorway that often leads to unnecessary suffering. For healthy seniors without symptoms, the risks far outweigh the benefits. Real peace of mind comes not from flooding the body with radiation but from choosing wisely, relying on proven, lower-risk screenings, and remembering that sometimes the best test is no test at all. As we close, let's pause and reflect on the 5 tests we've uncovered today. The full-body CT scan, colonoscopy after 70, the cardiac stress test, brain MRI for mild forgetfulness, and the bone density scan. Each one carries a reputation for safety, but for older adults, the truth is far more complicated. Instead of providing peace of mind, these procedures often introduce fear, side effects, or unnecessary treatments. The lesson is simple yet profound. Sometimes, less truly is more. A careful conversation with your doctor, a focus on lifestyle, and the wisdom to decline a risky test can protect not only your health but your independence and joy in these precious years. Now I want to hear from you. Have you or someone you love ever gone through a medical test that turned out to be unnecessary or even harmful? Share your story in the comments below, because your experience could help another senior make a wiser choice. And if you found value in this video, please take a moment to like and subscribe so you don't miss more insights and guidance for thriving in your later years. Together, we can build a community that values health, not just more testing.